my name is Jeff Greenfield, and I'm a professor of neurosurgery at Weill Cornell. And I've worked with Chiari Project before, and have gotten to know Ashley and Jared quite well. And it's our pleasure to be here again with some other invited guests who I'll get to in a moment. Jared approached me about trying to create a webinar that was focused really on the specific aspect of pain management in Chiari malformation, and that's really a central topic for every facet of how we take care of patients with Chiari. And when he asked me to do this, I thought that there was almost no way I could do this without having the rest of the partners in the hospital share this with me, because really this is so multifaceted. And so by way of introduction on this slide that I have up here, I'm at the top only because it's sort of the patients come to see me in the office, and we talk about the symptoms that they have. And pain is obviously a huge part of Chiari. That is in the form of headaches, neck pain, pain in their extremities, numbness and tingling. Those are all pain symptoms. But when we get to the point where we're talking about surgery, we're also then shifting into the question of what is the pain of surgery like. So you've got the existing pain of the condition, and then you've got worry and anxiety about what the pain of the surgery will actually impart upon them. And that's often really disabling for patients. And many patients, avoid surgery for years and years because of those fears and anxiety. So hopefully we can talk about both of those things. And then by way of, going around the circle here, once the patients actually make the decision with me and Amanda to, go forward with surgery, a big part of, making them feel comfortable is knowing that we've got a specific protocol and a really professional team that has taken care of literally probably over 1,000 Chiari patients in the operating room. That's led by Maria Bustillo, who's, been so kind to join us tonight. She's the director of neuroanesthesia, and hopefully can share some words on what she's seen as the evolution of our management of these patients in the operating room and how this has affected their transition from, the OR to the intensive care. And then seamlessly, Beth Higgins, our senior physician assistant in the hospital, will then pick up from that point on as the patients leave the intensive care and then begin really maybe their most important part of the pain management journey, which is getting through the surgical portion of their pain and figuring out how to manage all the different options that exist, how to deal with getting ready for discharge and the anxiety of taking over that pain management themselves once they go home. And then finally segueing back into Amanda, who started the process with me in the office. Amanda is our PA in the office, the director of the Chiari Care program. And she gets the handoff, calls the patients the next day, and carries the baton forward until about 30 days post-op, what point, if there are still pain-related issues, it usually goes back to a pain management expert or PCP. So all people on the screen are incredibly important at different points. And I think everyone's point of view is really important here as this has evolved over the years. So I'm really thankful for each one of you for joining us today. I think that's a great introduction to sort of the team that takes care of our patients here at Weill Cornell.